Hi, my name is Dr. Keith Eppich, and I'm one of the physicians at Village Health Partners. I wanted to speak to you today about the COVID vaccine. As many of you have heard, the FDA granted emergency use authorization this week for the Pfizer COVID-19 vaccine. There are other vaccines that are awaiting similar authorization by the FDA. So now that it has been authorized, the COVID vaccine by Pfizer will be shipped from the government to each state. Each state will determine its own prioritization for who gets the vaccinations. The CDC has set forth guidelines as to the prioritization of vaccine, but again, it is up to each state to determine the allocation of this vaccine. The state of Texas has indicated that the first tier of individuals who will be getting this vaccine are hospital workers and first responders. The rationale for putting them first is that it's important to keep the healthcare system functioning as more and more people get sick. We don't want to run out of ICU beds or nurses to care for those patients or hospitals to have to keep the hospitals clean. The second tier will be vulnerable populations such as those in long-term facilities. In addition, other healthcare workers will be in that batch as well. It's important to note that the state of Texas is still determining their algorithm of who will get the vaccine in what order. They have not yet published that information. At Village Health Partners, we want to be part of the distribution of the vaccine, and as such, we've signed up with the state to be distributors of the vaccine. We will be offering the vaccine to our patients and to the wider community. The date of when we're getting the vaccines is unknown. The state has not told us when we're getting the vaccines or how many vaccines we'll be getting. We want to be prepared because the logistics will be daunting for the nation and locally for Village Health Partners as well. But we've started a group to be prepared for this distribution of the vaccine. As such, we will be sharing through the website and through emails and through videos such as this information as it emerges. So I know many patients have been asking their providers when they can expect to get the vaccine and where they would rank on the prioritization list. We simply don't know that yet, and I know that's frustrating. It's important to note that by spring, we do expect anyone who wants a vaccine should have that ability of getting the vaccine. So, first thing I'd like to say with that in mind is that we do want most people to get the vaccine. It's important for at least 80% of the population to get the vaccine so that we develop what's called herd immunity. This is how we beat COVID-19. What's different now from the 1918 Spanish flu pandemic is that we have a robust scientific knowledge base through the development of vaccines, and also a strong infrastructure and supply chain. So we will beat COVID-19, but it's not over yet. We know cases are surging. So I ask you all to continue vigilance with safety measures such as wearing masks and limiting social gatherings and quarantining if you're symptomatic with upper respiratory infections, or if you've been exposed to someone with COVID-19. We want to continue these practices until we're able to get the majority of the population immunized. So with that, I'll end by saying we wish you all the best and a safe holiday season, and here's to a much happier 2021. Thank you.